Welcome back, Richard. It's good to see you again this morning.
Good morning, midweek.
Yes, midweek podcast, and this is a good one. We received a question from a listener who wrote in and said, "quote How do you help a high school student with conduct disorder and ADHD complete homework assignments?" She went on to write, "My grandson refuses to do homework. His mother wants to send him to a boot camp. I don't think that's the correct solution." And so how do you help a student, especially a high school student, which is different than if it was a younger student, but how do you help a high school student with conduct disorder and ADHD? How do you help them when they're trying to do homework assignments? And it's a great question. And as you would imagine, we get asked this question a lot. And as you would imagine, our answer may not be what people expect.
Right. I think when people ask these questions, they're thinking in terms of, well, what strategies can I use to get him to do homework? What, should I do this, or how should I solve this problem? Is there anything that I can do, any strategy I can use to get him to solve this problem?
Well, maybe more importantly, it's how can I just make him do it?
Well,
that's really the question.
I didn't want to push it that far, but you're right. How can I make him do it, or how can I entice him or motivate him to do it?
Right.
And the short answer to that is we don't have any strategies. We couldn't even begin to tell you how to motivate him. And the reason for that is because the problem isn't homework.
Right. It's not really a homework problem.
First of all, you're not dealing with a homework problem.
Right. So let's think about what we're dealing with, what this particular parent is dealing with. And that is, you have a high school student. So this is a teenager.
Right.
14, 15, 16 years old,
right.
17 or 18 years old.
He's an older teenager. So that's the first thing you have to keep in mind. This is an older teenager, not a middle schooler. Middle schooler would be different.
Right.
This is an older teenager.
Right. Okay? And an older teenager with conduct disorder. And so what that suggests is that we probably have a bit of a history here of, and especially a conduct disorder and ADHD. So we certainly have a history here of these kinds of problems. And so this isn't something brand new. I would assume this isn't something brand new that's coming along. Right. And when it's conduct disorder, what we're talking about is that we're talking about a kid who engages, or in the past has engaged in antisocial behavior, property destruction, theft, maybe even drug use, or just serious rule violations that violates the rights and property and space of other people. That's what conduct disorder means.
That's right. And that's where you begin with older teenager, moving very close to being an adult. Okay. As you say, he's over 15 or 16. But he has conduct disorder, which already puts us in a very precarious position, because this is a kid who has a history of rule violations. Okay.
Right.
Beyond that, this is a potentially serious mental problem. And that serious mental problem, mental health issue, I don't like to call it a problem, but it's a serious mental health issue. And that's the only problem that you should be addressing right now. Homework is not the problem. The homework is not the issue. Don't let homework get in the way, because anger over homework refusal, anger from you, anger from his mother, and anger with the boy is only going to make this problem worse. You're going to make the real problem, which is conduct disorder, worse. So forget about the homework, at least for now. And because you're going to be dealing with some pretty volatile circumstances, and you don't want to light that fuse. You're dealing with a kid who's got some antisocial tendency. So let's proceed very cautiously. Okay. Now, the reason we keep harping about this is an older teenager is that if his antisocial, rule-breaking, law-breaking, if that continues to age 18, two things are going to happen, all right? The first one is his diagnosis will change from conduct disorder to antisocial personality disorder. And that's a serious issue. And many parents don't realize that. We think of kids, just 17, 18, 19, 20. But in the eyes of the legal system and the mental health system, 18 is a very crucial um, mile marker.
Right.
The Mayo Clinic has a thing on this, and I'm going to quote here. It says, antisocial personality disorders, sometimes called sociopathy. And when you use the word sociopathy or psychopathy, you're talking about some very serious issues. So please understand that society is a serious issue. And this is a person who consistently shows no regard for right and wrong and ignores the rights and feelings and the property of others.
Mhm.
People with this disorder tend to purposely make others angry or upset and manipulate to treat others harshly or with cruel indifference. And they also don't have any remorse, they don't regret, or they don't apologize for their behavior. This is
Right.
a very, very serious mental health issue. So that's the first thing that changes. The
Right.
second thing that changes is that at 18, the legal system now considers this boy, this child, this teenager to be an adult.
Right.
Prior to this, you went to juvie. You went if you committed a crime, if you got caught with weed or you were shoplifting or something, you would go to a juvenile detention center. You would go to juvenile court. You would be treated as somebody who has, unless you've committed a serious crime like murder or robbed a bank or something, or some serious physical assault. You're going to be treated like a teenager. You're going to be given a second chance. You might have to write a letter of apology. You might get some short probation. You might get some community service hours. You make those same mistakes after age 18, and you're going to be treated like an adult. There'll be no
Right.
more teen court, no more juvenile justice, no more juvenile detention, no more warnings. You're going to be punished. You're going to be treated and punished like an adult. So
Absolutely.
there's a diagnostic change and there's a legal change that occurs at 18. So
Right.
that's the serious issue.
Right. And that's the conduct disorder part. And this writer wrote in and said that he has conduct disorder and ADHD. And so with ADHD, what we're talking about usually is poor impulse control, difficult time focusing and maintaining attention, maybe some hyperactivity or some drive to act, drive to behave.
Right.
So what this could mean is that we have a person who has a tendency or is prone to some of those maybe antisocial, some of those conduct disordered behaviors,
Mhm.
who also has impulse control problems, which means that they're more likely to do it on impulse. They're going to not necessarily think about what the consequences are before they do it. Not that they completely care about those consequences, but they're, when you're thinking about treatment or you're thinking about what to do about it, it's going to make it all the more difficult for this person to show improvement, because that impulse control problem related to the ADHD is going to make it hard for them to pause for a moment before acting on some of those impulses. So, we're really talking about a difficult situation. Again, a lot of people with conduct disorder and ADHD, even though medication will help with the ADHD symptoms, they'll refuse to take the ADHD medication as part of that noncompliance or that refusal, or I'm not going to take it just to upset you. So there's a lot of pieces, and the ADHD just compounds those problems even
Right.
more.
Yeah, you have a person who has these antisocial tendencies to begin with. That's how he got the diagnosis of conduct disorder. And so you know that he has these antisocial tendencies. And now you have a kid who also has ADHD, so he has no impulse control. As you say, they can't control their impulses. But there's another aspect to ADHD, and that is the problem that ADHD creates for this child's schooling and academic life.
Right.
Because with ADHD now, there's a good chance, about a 65% chance, that he also has a learning disability. So when we're talking about homework, we're talking about schoolwork, there's a good chance that this kid could have a learning disability, or that he just simply hasn't done much schoolwork and he's so far behind that he can't do the assignment.
Right.
So it may not be that he's not only willing, he's not going to do the assignment because he's oppositional, but he's not doing it because he can't do it. He
Right.
just doesn't have the academic skills to do it.
Right. And a person in that situation with this profile would present as presented as an oppositional thing as opposed to a can't do thing. It's going
Right.
to be, I'm going to refuse to do that, as opposed to I'll try it but then fail. They're not going to put themselves in that situation. They're not going to put themselves in a scenario where they will try to do the work only to fall short and then suffer that insult. So they're just
Right.
going to refuse.
Right. And you also have to remember that, yeah, because this kid isn't going to say, Mom, I just don't understand how to do this. Can I have some help? He's going to resist he's going to use bravado and, that sort of, to compensate for his failures. The other thing to remember is school is the place where his failures are most obvious. I mean, this is a boy who probably has a history of academic difficulties. So he probably hates school. He hates everything about it because it's where he gets in trouble.
Right.
He's not able to do the work. I mean, he's a high school student. He's probably taking Algebra 2 or something like that. And this would be a huge obstacle for him to overcome.
I was going to say that school is the place for failures, not just academic failures, but he's probably getting in trouble there too. If he has conduct disorder, he's probably getting into a lot of trouble there. So
Yeah, he's breaking the
not only can
rules.
he not do the work, he also doesn't comply with the expectations there behaviorally, and he's getting in trouble too.
Right. And so you say, well, he's not doing his homework. And I would say, well, of course not. Why, how could he? Why would he? Um, this is the, you're putting him in front of the failure screen. Here, this is your failure. Please get to work on it. Okay.
Yeah.
That's not going to happen, especially with a kid with ADHD and or conduct disorder.
Right.
The other thing is if he's doing homework, it's probably after 3 o'clock. So even if he did take his medication, it has worn off by 3 o'clock. And so now you have a child who has all these issues and he's not on, it's essentially he's not on medication. Okay.
Right.
So when you think about his personality profile of being a little oppositional, and you think of the possibility of learning problems on top of that, and the fact that he's not on a therapeutic dose of medication, you're looking at some pretty daunting obstacles to homework completion. So this is a battle that homework is not a battle that I would take up with this boy right now, because you're probably going to lose it, and there's going to be a lot of anger. It's going to be a very heated discussion, and it may not end well for anybody.
Right. Yeah. So at best, you're just dealing with an angry teenager who doesn't want to give in to his request, to your pressure and the desire for him to do his homework, probably because there's other things he'd rather be doing, and because he
Right.
certainly doesn't want to do the homework. And so while you're battling about homework, parents get into this position where they start to panic. They start to, reach for those tried and true weapons of threatening, bribing. Parents will get angry and start yelling and doing all these things.
Right.
And of course, especially with a teenager, those approaches are not going to work.
Right.
Especially with a teenager with ADHD and conduct disorder, they're just not going to work.
Right.
Because again, the problem isn't homework. The problem is much greater than that. And homework is incidental. My guess would be that if you asked him to take out the trash, he probably doesn't do that either. If you ask him to clean up the room, he probably doesn't do that either.
Right.
When you think about the diagnostic characteristics of conduct disorder, he's probably not doing much that you're asking him to do.
Right.
So,
Yeah.
so I would put, we got to back away from homework just a little bit.
Yeah, the problem is not homework. We understand why you want him to do it, but I came up with all sorts of analogies that we could talk about, comparisons, but we don't need to go through those. Just, you're right, parents are going to panic. They're going to say he has to get this done. He'll fail this class. He won't get a high school diploma. And I understand why parents get into catastrophic thinking and why the stakes seem to be so high. But please believe us that homework is not the problem that you're dealing with, and you need to deal with the real problem that's confronting you. So none of these things that we typically do at such times, threatening, bribing, temper tantrum, the parent throws a temper tantrum, and then you get into these very heated battles with your children of power struggles, and it's not going to accomplish. None of these things are going to work. because
Right.
the problem is in homework. All right. So our advice, you said, well, how do we get him to do his homework? I don't think you should try to get him to do his homework. I think what we would advise is stop all the battles, okay? Because you're going to lose all those. All right. So,
Right. I think that parents have a hard time understanding this, that the more work you put into making them do their homework and he still isn't doing it, the
right.
more likely it is that you're going to fail at that attempt tomorrow and then the next day and the next day. And so you need to back off of that. And really what you need to work on is
Mhm.
sort of just in the very least coexistence.
Yeah,
You
just
work on how can we relate to each other and work on focus on the relationship a little bit,
mhm.
because the more attempts you make at doing something and fail, the more likely it is that you're going to fail the next time you try.
Right, right. And so the best thing to do is just back up a few paces. And work toward peaceful coexistence. Get to peaceful coexistence first. Stop all the fighting about these mini battles. These are mini battles. These are sub context, sub wars. Don't fight those. Okay, you have much bigger things to accomplish. And so we would suggest that at the top of your list would be something that we call some kind of comprehensive management of this complex problem. And there are two general approaches that you can use to solve the problem of conduct disorder and ADHD and the resistance and the oppositionality that you're feeling, okay? And those two general approaches are behavioral parent training.
Mhm.
What can you do? What can you do to learn how to do this better? And then the other is cognitive behavioral skills training. And and so we can explain each of these sort of in general terms. And if you have more specific questions, we'd be happy to answer them. But I think back away from the homework, back away from the little battles, and develop this comprehensive approach, which is in two parts. And the first is
Right.
behavior parent training.
Yeah, and the key part of behavioral parent training is to starts with just psychoeducation. As the parent, you have to understand what you're dealing with. Know your enemy. Know
Right.
your adversary. What are you going up against? And again, if you understand in this context what conduct disorder and ADHD, what those disorders mean, and what they mean in the case of your teenager, you're going to be able to approach it in a much better way. So you need some psychoeducation and best ways to understand what's happening.
Right.
Um, the other thing is what we call contingency management training. You got to look at how you're reacting to things and what consequences you're applying, and just how you're managing these behaviors that you're having a problem with.
Mhm.
Because how you respond to the behavior is going to, in part at least, predict the next set of behaviors that you're going to encounter.
Right. That's right. And so the first thing is know what you're dealing with. Sit down with a professional, figure out what you're dealing with, understand impulse control, understand lack of inhibition, understand learning disabilities, figure out the total picture that you're dealing with, not just homework, but there's a total picture you're dealing with. Get to know that. Second step is you got to get to calm. You have to calm this thing down. You have to lower the temperature in your house. Homework isn't the only thing you're fighting about. We're absolutely convinced of that. There are many other battles that you're probably fighting. So let's calm everything down. Let's get to calm and stay there. And then parents say, well, we have to have limit. We can't just let him do whatever he wants. He can't
Right.
just not do homework and do. We agree with that. There have to be some limits, okay? But the limits have to be realistic and age appropriate.
Right.
When we say realistic, we mean realistic for a person with conduct disorder and ADHD who's 16 or 17 years old.
Right.
That's very different from a 10 or 12 or a 13 or 14-year-old.
Right.
Okay. So yes, there must be limits, but they have to be realistic and they have to be age appropriate. The only two things you absolutely have to deal with are the two Ds, dangerous and destructive. They can't do anything. They can't be destroying property, yours or anybody else's. If they do that, then that's a legal question. That's a legal issue that you have to address. And anything that's dangerous that endangers other people or themselves. I mean, that's why we have things like a Baker Act. So the only things you have to respond to are dangerous and destructive. Everything else is negotiable. All right.
Absolutely. And then the when you once you have your limits and you know what you're going to ignore and what you're going to set aside and what you're going to focus on, again, parents often want to know what should the consequences be. And as we have said many times, we don't necessarily um encourage punishment, but we do, consequences are appropriate. Consequences are,
Right.
what happens in response to a behavior. And
Mhm.
so we always gravitate towards teaching rather than punishing. And so, when you're talking about consequences for non-compliance, there's consequences for compliance. Sometimes for some people they'll give rewards and they'll give lots of positive praise and all that kind of stuff. Um, but for some reason, we always lean towards punishments when we talk about consequences for non-compliance.
Right.
We need to make sure again that we know what we're dealing with and what we're trying to manage, so that we apply the appropriate consequence to the behavior that the kid's doing.
Right. Yeah, and keep in mind, there are consequences for non-compliance, but consequences for compliance. And we typically don't think about the positive things that our kids that every kid is doing. I mean, there are going to be days when this boy, no matter how recalcitrant and resistant and oppositional he is, there are days when he's not going to be. Acknowledge that. Okay, that's consequence for compliance, right? And then there's the last thing is stress reduction. And we talk about that all the time, that you have to have good nutrition, good sleep, and exercise, and you have to manage stress. And getting to calm in your house is going to be a matter of reducing the stress on you, but also on this boy. And if you're pounding away on his homework, that's not stress reduction. That's going to make a bad situation worse. So the last thing that you have to have a plan for is how are we going to reduce the stress both to us and to the teenager?
That's right. And you mentioned earlier that there were two general approaches to management. One was what we just talked about, the behavioral parent
Mhm.
training. The other is called cognitive behavioral skills training. And it's like cognitive behavioral therapy, but because what we're
Right,
talking about is changing the way that you think so that you change the way that you behave.
right.
And again, because we come from the approach of teaching rather than punishing, we want to make sure that we teach skills so
Mhm.
that kids can engage in the behaviors that we want them to behave in. So this may include social competence, helping them to understand what good interactions are with other people, and what the benefits are for having good interactions with other people.
Right,
Uh, Teaching them how to self-regulate, how to control some of those impulses, how to manage some of those emotions and behaviors, but also complying with authorities. Sometimes kids, because of personal experiences or just because of vicarious experiences from peers or whatever, they have a really negative impression of authority figures. And so teaching what the role of authority figures are, to make sure they understand why it's important to have authority figures, and for having people that sort of police over behavior and what's
Mhm.
going on in society, in wherever you are, at school or at home, to make sure that everybody's safe and everybody is, behaving in appropriate ways. And so all of that requires cognitive behavioral type treatment, so that, hopefully in changing their thoughts and the way that they understand it, you'll change some of those behaviors.
Right. And when we talk about complying with authorities, um, teenagers kind of by nature are, anti-authority. It's part almost by definition. They're a little bit opposed to authority. But make them understand that if they do cross these legal boundaries, they're going to get in trouble. And at their age, it's not going to be a pleasant experience. And so, no, you don't have to comply with authorities, but they're going to always win. If you're a teenager, the authorities are going to win those battles. I mean,
Right.
you're not going to outdo the police. So make them understand that the realistic approach to complying with authority figures, whether it's, it's like teacher. Well, my teacher wasn't nice to me, so I'm not going to be nice to her. Well, that's fine, but you're going to lose that battle because the teacher has all the authority. You're
Right.
not going to you're going to lose these battles with authority figures. So
Yeah.
that's
They
not to
say,
endure.
they say, oh, well, I'll fail the class. Yeah, that's bad for you. The teacher's just going to be there again next year, and probably going to have the same teacher next year. So you might as well just pass the class and get on with it. So
Right. But it's a training, it's educating kids about these things. And then of course the last one is managing stress, same issue. Okay.
yeah. So some things
So,
to keep in mind
yep.
as we
Yeah.
wrap this up.
Hmm.
A few things to think about. Focus on some positives.
Right.
And we're not, we just did a podcast last week on the, being, toxic positivity. We're not talking about that kind of stuff. But when you're conduct disordered or teenager with ADHD does something well, or when they are helpful, when they are compliant, when they are cooperative, thank them. Hey, thanks
Right.
so much for taking the trash out without me having to ask. I really appreciate that. That's
Right.
thank you.
Right.
It doesn't have to be anything more than that. It doesn't have to be fake, but just thank them and give them some positive feedback when they do things that the way that you would like for them to do it.
Right. The other thing, it's a tricky one, but we say take a break when you feel yourself getting worked up as the adult. When you feel yourself getting angry, getting worked up, separate from the situation, take a break, move away, give
Mhm.
yourself a timeout, okay? Because what you want to do is you want to model that behavior for the child. The other thing to remember is that if the child does that, you can't then accuse the child of being disrespectful. What the child is doing is the same thing that you're doing. They're moving away from you so that it doesn't escalate. That deserves positive reinforcement, not you're being disrespectful for
Makes
walking
me
away.
crazy when I'm talking to a family and
Right.
the kid is like, I'm just so mad. I'm going to go to my room. And they go to their room, and the parent follows them into their room to keep
Chases
yelling at
them
them.
down.
Give them a break.
Right.
Step back, because it's not going to turn out well. And never has it turned
Mm.
out well. Like, I've never had a parent come in and say, you know what? He was so angry and he walked out to it. He just tried to walk away into his room, and I followed him right in there. And then we ended up hugging it out. It was great. That
No,
never happens. It
no,
never
it,
happens.
it just escalates even more. Right.
Right. So
Mhm.
let them walk away, give them a break. It doesn't mean that you're not going to talk about it later, because
Mhm.
God knows you're going to talk about it again later. So
Right.
let them walk away and just give them a break for a few minutes, and then you can re-enter that conversation when you're both a little bit cooler.
Right. The other thing to remember about a kid like this boy is he has a hard time avoiding power struggles. That's very important to these kids that they want to win. So don't get involved in power struggles.
Yeah.
Okay. Just avoid it at all costs. You're going to lose most of them. You're going to probably lose all of them. So don't engage.
Which is why don't make homework a battle.
Right.
That's
It's a
not
power
a battle
struggle.
you can win. So
Right.
I wouldn't make homework a battle. I would
Mhm.
focus on the other things that are far more important for their, safety and for their hopeful future.
Right.
Don't battle over homework.
Right. That's right. Um, Make sure that whatever you come up with are they're age appropriate. This is a person who's almost an adult.
Yeah.
And if you start saying things like, well, you're going to have to do this, or you have to go to bed at 8 o'clock, or we're going to take away this or take away, be very careful what you take away and what you threaten. You're almost dealing with an adult. This kid is somewhere between 16 and 18, and you're too close to adulthood to think that you're the parent and what you say goes. You're going to have to negotiate, and this is an adult to adult relationship. It's no longer at this age, it's not adult child, it's
Mhm.
adult to adult. And you're going to have to treat this kid like an adult, whether you like it or not.
Right. Yeah. And it's we haven't even talked about the idea that this teenager could be driving.
Yeah,
Um, and
get in the car
and
and drive
what
away.
parents will try to do is, well, if you don't do your homework, you can't have the keys. I'm taking the keys to the car. Okay, think about what that means.
Right.
That's a heavy consequence that's going to put a lot on you. And believe me when I say there are teenagers who won't care, because they know that that means that they're putting you out,
Right.
because now you're going to have to get them to school. You're going to have to pick them up from school. You're going to have all of these things. Oh, you want me to be, you want me to be in band, or you want me to play on the football team, but well, that means you're going to have to
Yeah.
take me to practice. You're going to have to pick me up if you take the car away. And parents were most parents just aren't going to stick to that. And
Right.
so it's not going to be not a good consequence. So again,
Right.
age appropriate, make sure that it doesn't make things worse. And
Mhm.
um, you know, you have to manage your time and your energy to make sure that you choose the right battles and that you um aren't taking things on that just going to make things worse for you.
Right. Yeah. Um, The other thing is don't focus, especially if you have other children, don't put so much energy into this child that you're forgetting about everything else. Okay, you have other responsibilities. You can't invest all your time and energy into this one person. You have a house to take care of, you have a marriage to take care of, you have other children to take care of, and make sure that you save time and energy for all of your responsibilities. And the last one is managing stress, but we've talked about that many times. You have to you have to manage your stress, but you also have to help everybody in the family manage their stress. Remember, the idea is let's lower the temperature, let's get the whole house, let's get everybody back to calm so that we have a peaceful environment where we can talk about and negotiate some of the struggles that we're having. So the advice here, we're not going to give you advice about how to motivate him or encourage or force him to do homework. This is a much more complicated problem, and it's going to require a complex, a comprehensive solution. And you're probably going to want to consult with a professional who will help you put together that kind of a program.
Right. Absolutely. I was just going to say, working with a professional is going to be critical
Yeah.
these kind of situations. So we hope that was helpful. Probably not entirely hopeful because we're not telling you just do this and he'll do his homework
It'll
without.
be okay. No, no,
There's
this
nothing
you're
like
you're
that.
dealing with a real complex problem. So
No,
make sure that you come up with a real comprehensive solution. Get the help, get some support, and make sure that you take care of yourself and avoid these power struggles and take better care, take good care of yourself. It's going to require a lot of patience and a lot of energy.
absolutely. All right. That is it for today. Until next time, stay happy, stay healthy, and forget to be afraid.